Over the past several weeks, I've been sharing a series of short podcasts introducing the concepts of aging in recovery and the aging in recovery residential model, or AARM. Those earlier conversations were intentionally brief. Their purpose was to begin naming something that, in my opinion, has remained largely invisible within both the recovery community and the broader systems of healthcare, social work, aging services, and substance abuse treatment. Today, I want to begin shifting the conversation forward, not backward into what we've already discussed, but forward into the questions we still have not fully asked. For decades, our systems have understandably focused on active addiction, overdose prevention, detoxification, treatment access, relapse prevention, and crisis stabilization. Those issues remain critically important even today. But what happens when people survive? What happens when people remain clean and sober for 20 years, 30 years, 40 years, or even more? What happens when individuals who once fought simply to stay clean, to stay alive, begin confronting the realities of aging? Where is that research? Where are the longitudinal studies examining the physical, emotional, neurological, social, and economic realities of long-term recovery across the lifespan? Because the truth is, we know far less than we should. Sure, we know how to study addiction in crisis, but we know far less about recovery sustained over decades. And we know even less what it means to be aging in recovery. As someone with long-term recovery myself, and as a licensed master social worker, I believe this emerging population deserves far more attention than it has received. Not everyone aging in recovery requires intensive services. Let me be very clear about that. Aging in recovery does not automatically mean impairment, disability, or dependence. Many individuals in long-term recovery are thriving. They've established careers, are working, volunteering, mentoring others, building families, participating in fellowship and in the civic life of their communities, and many are making meaningful contributions to society. But some do require support. Some experience accelerated aging, chronic health conditions, trauma histories, isolation, mobility limitations, financial instability, cognitive decline, or the cumulative effects of decades lived under difficult circumstances. And importantly, many traditional aging services are not designed with recovery culture in mind. Likewise, many recovery-oriented systems were never designed for older adults. That gap matters. And it is precisely within that gap that concepts like Never Alone home care services and the aging and recovery residential model begin to emerge. Never Alone home care services and the aging and recovery residential model are not based on the assumption that all older adults in recovery need services. Rather, they are based on the recognition that some will. And if we fail to study this population now, we risk building systems that remain unprepared for the future. This is not simply a treatment issue. This is a social policy issue. It is a healthcare issue. It is a workforce issue. And increasingly, it is an aging issue. Over the coming videocast, I want to broaden this conversation by speaking with policymakers, social workers, researchers, treatment professionals, and people with lived experience, that is, those that are aging in recovery, older adults in long-term recovery themselves. Because the voices of people aging in recovery must be part of this national conversation now, not later.